Hey, my name is Alexis Ariola. I'm a nurse practitioner here at Legacy Medical, and we're here to talk to you today about ACS. We're here introducing
Dr. Michael Ruttman, board certified in internal medicine.
Yes, and my name is Venus Nguyen. I'm a family nurse practitioner working here at Legacy MD.
My name is Joanna Falcon. I'm a family nurse practitioner as well here at Legacy MD.
We're so excited to be sitting here today again talking about a new topic, right, doctor?
That's
Which
correct.
is coronary artery disease, correct?
Correct. We're going to be talking about coronary artery disease. And as you are aware, the heart is a muscle and it's a pump, and it pumps blood throughout the whole body. And if we can get the picture of the heart put up.
I think we should restart.
It's up there.
Okay. Oh, so that we can look at the circulation of the heart. As you're aware, the heart will require blood supply and oxygen on a regular basis, and there are three main arteries that bring blood and oxygen to the heart muscle itself. And when we're talking about coronary artery disease, we're talking about blockage of those arteries, usually due to cholesterol buildup in the arteries, and also damage to the arteries from high blood pressure and or smoking is also a major thing that can damage the arteries and lead to coronary artery disease. Now, it's important to understand that this is maybe a life-threatening problem, and will cause a lot of patients to end up in the emergency room with chest pain. I think we should tackle first the most common cause of blockage in the arteries, and that is elevated cholesterol in the patient's blood.
That's right. So CAD, or coronary artery disease, is very prevalent here in Imperial Valley. Besides, us living in a rural area, we have a high populations of obesities. And among, our populations, we have patients who have very high cholesterol, and high cholesterol is a primary cause of CAD. If you have been into the office and if you've had your labs check or blood checks, you'll notice that a lot of times we screen for cholesterols. The goal is to keep your cholesterol at a control level. Why is cholesterol a contributing factor or a primary cause of coronary artery disease? It's because LDL, which is short for low density lipoprotein, that's a bad cholesterol. And when you have elevated or high levels of LDL, correct?
Sure.
It can aggravate or irritate the inner linings of the arteries. And when there's inflammations going on in the arteries, it's easier for the cholesterols, especially the LDLs, to grab onto the arterial walls and build up plaque. And when there is plaque built up in the arterioles, it can cause for the arteries to narrow, and that in turn can cause heart attacks if it is a major arteries that is narrowed. Correct?
ultimately what happens too is you could have a plaque rupture, which then creates a blood clot, what then causes a blockages in the heart, and that would be what your most layman term of would be a heart attack. In the medical community, we call it myocardial infarction, and it's something we see commonly in the emergency departments. When you come to the emergency department, you'll notice we do an EKG, we'll check blood work, and this is so that we can be looking for signs of heart stress on the EKG or in the enzymes in the blood we check. If we do see that you're having a heart attack, we do have to, unfortunately, send you to a cath lab, which the Valley does not have a cath lab. So we have to arrange for a transport for you guys to get to a cath lab if you do have a heart attack. And we try to do this as rapid as we can in order to prevent what we call heart failure. Because the more time that heart muscle isn't able to get the blood because of the block in the blood flow, you're more and more likely to have some of that heart muscle die, which then ultimately would lead to heart failure.
So I think the whole point of us sitting here and talking to you is that we don't want you to get to see Alexis in the ER, because
I want to see you here.
exactly. Because in the primary care setting, we are all about preventative medicines. We want to be able to prevent you from having CAD in the first place, correct?
Correct.
Yes.
Yes.
And,
Yes.
and
Yes.
a lot of times, you might hear people, they have CAD and that's when they may present with symptoms, but CAD doesn't start from one day to the next. So it develops over time. So that plaque buildup, that cholesterol buildup may take years and years and you might not even know it. So you may have no symptoms at all. So it's very important to be constantly getting your annual exams and checked at your provider. And one of the leading causes of CAD along with cholesterol will be high blood pressure. So many people in the valley diagnosed with high blood pressure. Others may be walking around not knowing they have high blood pressure and they may have elevated blood pressures because many times it's asymptomatic. There's no symptoms.
That's why we call it the silent killer.
Yes, correct, Alexis. And what happens when you have high blood pressure and you have CAD or already a plaque buildup, or even without that many plaque buildup, high blood pressure causes pressure in the walls of the arteries, and that can cause damage to the lining of the walls as well as an acceleration of that plaque buildup as well. So, like Alexis mentioned, high blood pressure may cause a rupture of that plaque in the artery and lead to a complete blockage, which leads to a heart attack.
So let's say for a minute that you walk into your doctor's office and your doctor checks your blood work and says, John, you have high cholesterol and you need to do something about it. Well, where did my high cholesterol come from? Mm-hmm. Okay. So you have to look at your diet. What kind of diet do you have? Are you on a low cholesterol diet or a high cholesterol diet? Are you eating a lot of meat? Are you eating a lot of cheese and eggs and things that could build up in your arteries from the high cholesterol? Those are foods that are particularly high in cholesterol. But maybe you tell your doctor that I have a pretty good diet and I don't really eat that much high cholesterol food. Well, what about your family history? Do you have high cholesterol in your family? Do did your father die of a heart attack when he was in a young age? Was he treated for high cholesterol when he was older? So you have to look into your family history. A lot of times you may have a strong family history of high cholesterol, maybe in your father, your mother, brothers and sisters, and therefore you inherited this high cholesterol in your family, and you still have to deal with it, even if you didn't do anything about it, as far as eating the wrong kinds of foods. So a lot of times it'll be changing in your diet, being on the right kind of diet, but maybe diet alone isn't the answer. Maybe you need medication to lower your cholesterol.
Absolutely. So if it's a hereditary problems where you've already changed your lifestyles, you've already on a healthy diet, yet you can't bring, your cholesterol number down because it's hereditary, then you would need, pharmacotherapy, correct? Added medications to help, control your cholesterol level, especially your LDL level, correct, doctor?
Correct.
Yes, and one of the main medications, the first line pharmacotherapy is statins, correct, doctor?
That's correct.
Yes.
So now, on the internet and in different circles, statins have gotten a very bad reputation. People say that they can cause brain problems, or they can cause this or cause that. Just to let you know, there are millions and millions and millions of people are taking statin therapy to lower their cholesterol, to prevent the blockage in their arteries and subsequently prevent a heart attack or a stroke. So these medications are really relatively safe. There's really only a very small percentage of people who can't take the medication because they may be allergic to the medication or they get side effects from the medication. Probably less than 5% of the people who start on statin therapy. So I think it's important for you to discuss this with your physician if you are concerned about the efficacy of the statins and if they could cause potential side effects.
Right, right. And sometimes you'll notice that if we start you on a statins and it's not enough to lower your cholesterol, especially the targeted LDL, you will see that one of us providers will add on, another class, which is very common. Or if you can't, tolerate statins, the next class of medications that we would give you to lower your cholesterol would be the PCSK9 inhibitors. One of the common meds is ezetimibe, correct? And you'll see that given very commonly for patients who are at high risk or who is status post, myocardial infarct. This will help lower your risk of mortality, correct, doctor?
That's correct.
Yeah, and that is recommended by the American Heart Association. If you had an event of, a previous history of post-event of a myocardial infarct, we would automatically put you on a statins as a preventative measures so that you don't incur another heart attacks, correct, doctor? And it also decreases your mortality rate, correct? Yes.
Yeah, that's true. And also, if we're going to be talking about high blood pressure as a potential cause for coronary artery disease and blockage in your coronary arteries, we have multiple medications that we can use and in different scenarios to control your blood pressure. And controlling your blood pressure is very important. That when your blood pressure is elevated, it puts an excessive strain on your heart, and the high pressure can damage your arteries, not only the coronary arteries but other arteries as well. And arteries are one of the most important organs in your body because they're the ones that carry all the blood and oxygen to all your organs to feed them and keep them alive. And so it's important that your blood pressure is controlled. Right now, the recommendation is that you get your blood pressure in the 120/80 range. 120/80 range is very difficult to attain with just one or possibly two medications. Sometimes the average actually in the country is probably 2.5 to 3 medications to adequately control somebody who has high blood pressure.
But there are lifestyle changes that can be done to control high blood pressure and to prevent coronary artery disease and to prevent diabetes as well, which is associated with coronary artery disease. One of the things I'm seeing in a lot of videos online these days is there's people that are upset. They feel doctors are kind of hawking medication and we're paid by pharmaceutical companies, which is not true, by the way. We don't get paycheck from pharmaceutical companies. We don't get any benefit for prescribing versus not prescribing. Our benefit is our patient does well and the patients like us. But I think we should talk about lifestyle changes that prevent all this.
Absolutely.
Absolutely.
Absolutely. And one of the main the main topic that we should discuss about lowering blood pressure is probably obesity, correct?
Oh,
Managing your
absolutely.
weight.
We're not exercising enough in this country. That's why coronary artery disease is the #1 killer of Americans it's the #1 killer. In fact, sometimes it's difficult to talk about family history of patients because if I ask you, do you have a family member that died of a heart attack? Yes, everyone does. Everyone does. So sometimes it is difficult to know who has that hereditary cholesterol and who doesn't because when it comes down to it, our lifestyle is going into this. Yeah. The American Heart Association recommends that we exercise with vigorous activity for at least 130 to 150 minutes a week. That can be broken up into 4 exercises that are 30 minutes each to make that 120 to 130 minutes each, where you get your heart rate up about 20% more, at least what your resting heart rate is. Now, that doesn't mean you have to be a marathon runner. That means you take a very brisk walk after dinner, every day, or you go for your morning jog. It could mean that you go to the gym, every other day and you go get on the treadmill there.
Swimming
is a beautiful one. Swimming is a beautiful one for our people with arthritis because it won't put pressure on your joints.
Right. There's bicycling. Even if you have a stationary bicycles, it works. Any type of activities that would get your heart rate above, 100 is considered, cardio workout.
Now, obviously, when we're doing cardio, we're
Dancing.
going to see an elevation in your blood pressure. But they say 30 minutes after you've gotten back to resting heart rate, you should see about a 20-point drop in your blood pressure post cardio. That's why cardio is a big part of controlling our blood pressure, because getting your heart to do that work is a big part of getting that blood pressure down. Getting your blood to pump and move is a big part of clearing cholesterol out of your arteries. Exercise, again, also is a big part of controlling obesity, because as you spend the calorie, doing this cardio, you then give yourself this calorie allowance that you're allowed to eat. The same person who is working out every day does not need to eat the same as someone who's sitting in an office every day, and that's just science. I mean, if you have a sedentary lifestyle, then you really shouldn't be eating a whole lot, but our lifestyle doesn't always dictate that. What we do is we go to work all day. We have high stress lifestyles, which pumps up our blood pressure. And then we don't have time to cook. So we rely on conveniences like fast food, processed food.
foods.
It's this American lifestyle of on the go all the time that then leads us to make these bad choices, this sedentary lifestyle, because we're working extra hours. Then we go to get the fast food because we don't have time to cook us a healthy meal. We have to realize that this is going to end up in an early death.
So if we're talking about lifestyle changes, I think we can't leave out smoking.
Definitely.
Smoking is, some people consider it the worst that any person can do. The nicotine in the tobacco, and then this includes vaping too. It damages the blood vessels, and it so that once the blood vessel is damaged to some degree from the nicotine, a little nick in the blood vessel, then that's where the cholesterol starts to build up, and platelets go there, and it starts to form obstruction to the blood vessel. So smoking is, really, I'm glad to see that a lot of people have quit smoking, and it's an ongoing thing, but there's still a lot of people who are smoking and they really shouldn't be, or vaping, and because it's very damaging to the blood vessels.
It does cause long-term damage, and we can tell you, sitting here telling you that it does, even though you don't see it, but long-term, it will cause microvascular disease.
Right.
So any small blood vessels, especially in your brain, once you have microvascular disease, it's so easy for you to stroke out. It's so easy, and when you stroke out, you have multiple stroke out after that. Correct, doctor?
That's right. That's correct.
Yeah, so it's really important to quit smoking, just for your overall health. And also, smoking is a major contributing factors for CAD, because it can cause hardening or atherosclerosis of the blood vessels.
Yeah, and it's not. Unfortunately, it's not only the heart blood vessels, but it's all the blood vessels in your body. It can cause narrowing of the blood vessels that take blood to your legs. It can cause narrowing of the blood vessels that take blood to your eyes, so that your eyes can be damaged. So that it's a very serious habit that really needs to be discontinued. We should also talk, I think, about diabetes. Diabetes, and I know there's a lot of diabetes here in the Valley, and people need to understand that they need to get control of their diabetes. They need to control their blood sugars on a regular basis, and that involves around controlling what they're eating, taking the proper medication to control their diabetes, and getting the proper amount of exercise, etc. When your blood sugars are high and out of control, that leads to buildup in your blood vessels, and along with high cholesterol and hypertension, all those things together accelerates the damage that's done to your blood vessels and causes more and more narrowing of the blood vessels. So it's important, and I know it's very difficult to control your diabetes, because it's really a significant lifestyle change. You have to watch what you eat. You have to watch your exercise. You have to take the proper amount of medication to control your sugars. But if not, then you're going to get a lot of damage in your blood vessels. All the ramifications of diabetes revolve around narrowing the blood vessels. Your eyes, you people with diabetes go blind because the blood vessels to their eyes are narrowed. They lose their limbs, their toes, and their legs because the blood vessels to their legs are narrowed. They get heart attacks and strokes because the blood vessels to their brain and the blood vessels to their heart are narrowed.
Dialysis.
And they end up on dialysis because the blood vessels to their kidneys are narrowed. And so it can be as bad as cancer.
Right. And talking about this, diabetes type 2 is something that you acquire.
Right.
It's because of your sedentary lifestyle.
There's a lot of people that really fix on that genetic factor. But locally, there really isn't a whole lot of people that are genetically proclaimed to diabetes. It's the lifestyle that you've learned from your family. It's just like ACS. Have you had a family member that died of a heart attack? The answer is going to be yes. Down here, do you have a family member that's been diagnosed with diabetes? I could tell you personally, half my family, yes. No genetic predisposition to diabetes. It's our vitamin T, tortas, tortillas, tamales, all the good stuff for Christmas, right? It's a holly jolly video right now. But diet is so important when it comes to controlling our diabetes and our cholesterol to prevent that ACS. Our bodies, if we take in a carbohydrate, and a carbohydrate would be like a tortilla or a bread, something that is kind of that starchy, we are supposed to work it out. We are supposed to go run it off. We're supposed to work it off. Whether that be construction, physical work, physical labor, or exercising. But what happens is we eat, a bread and a coffee for breakfast, and the coffee has creamer that has sugar in it. And then we go and we sit in our office job, which I'm sure is very stressful, but unfortunately is not going to work out those carbohydrates. So a high protein, diet is also very important as far as like going in forward with preventing diabetes and ACS. And I would recommend that if you've been diagnosed with high cholesterol or diabetes, to speak to a nutritionist so you can sit down with a 24-hour diet log. What am I eating that's contributing to this? Because your idea of food might be so ingrained in just your daily routine that you may not realize simple things can sometimes be turning this all around, Maybe you're eating a high sugar yo plate that's full of fat and sugar, and instead we could get you on a high protein yogurt that has less sugar and has less cholesterol. You want protein. But
also changing like little things like consuming water. Yes. Hydrating.
A lot of people don't
Drink
Yeah.
water.
Water.
Yeah.
Yes.
Yeah, instead of reaching for sodas or sweet drinks, grab a water.
Definitely drinking more water. And we realize it's difficult. The food industry has done a great job in getting people addicted to sugar and high
And
cholesterol.
caffeine.
Yes.
People go to Starbucks and they think that's intake of fluids, but no, that's
Yes,
it's a direct-
That's
that's
a
lot
sugar
of
bomb.
Sugars, carbs. Yes,
the carbs, yeah.
yes. So, as you see here, we lead by example. Most of us here, if not all of us, are drinking water. Rarely do you caught me grabbing a soda. In fact, when I go shopping, I never buy sodas. There's no sodas at my house, just so you know. And then Bo and I are going for walks every day. We take the time. We, busy professionals, but we do take the times, to go walk. We do brisk walk, just, to relax and de-stress. And it also, give us, the amount of exercise that we need, for the day. Well, besides walking at the office, we all
Yeah.
walk on our feet a lot.
I think the most important thing is there's a lot of things out there that are detrimental to you in your lifestyle, and you may not be aware of those things, nor are you aware of what's going on. Maybe are you a diabetic? Do you have coronary artery disease? Is there something that you need to change? One of the most important things, I think, is to see your physician on a regular basis.
Routine
Go in
checkup.
for a physical. Go in for a physical and find out if you have problems. If you identify your problems, then you can take steps to alleviate the problems. But if you hide your head in the sand and you don't go and get your cholesterol checked and get an EKG for your heart or get a blood work or things like that,
Check your
then you're not going
vitals,
to
check your
know
blood pressure.
you're not going to know what the problem is. And then once you find out what the problems are that you have, then you can address them. Because there's a lot of problems out there.
Yeah.
Talk
You know?
about also if you have been diagnosed with CAD, to be aware of the symptoms that you may be experiencing that would lead you to go to the hospital in an emergency, which would be chest pressure, chest pain, shortness of breath. In women, we talked about they can have atypical chest pain, which is present with epigastric pain, nausea.
I think that's super important to bring up. The fact that not everyone gets chest pain when they start having a heart attack. Sometimes it presents in the form and you feel severely weak and you're nauseous.
Yeah.
And sometimes the pain radiates to other places, like it goes up your neck or goes down a shoulder. There's a lot of people that come into the ER telling me they have shoulder pain, and, we order an EKG, we order a troponin. These are the tests you want to look for in a heart attack. And, a lot of them will come back normal. And then we tell them to go back to their primary care doctor so they can manage their cholesterol, they can get into a cardiologist, but you do need to go if you're having those symptoms, because
it could be angina, but then it could be a heart attack. So
it could be unstable angina, which is almost as bad,
Yeah.
Right. So for women's who have, acute onset, all of a sudden, if you have, nausea, that's not normal, especially if it's not associated with indigestions, with gastritis, or even with no food nearby, no smell of food. All of a sudden, if you have severe fatigue, you feel chest pressure and acute
a lot of them
nausea.
won't feel the chest pressure.
Yeah, or sometimes you don't feel the chest pressure.
they may feel like a epigastric pain,
They just feel, because the heart,
They think
well,
it's
the heart is right here and then the stomach is right here. So some people just come in saying their stomach's hurting because it's right next to each other, which
Yeah,
can
they
be,
could be
I understand it's very tricky,
It is tricky, but if it is gastritis, normally if you take an antacid, it would, alleviate it.
You'd feel better within 30 seconds if it's an
Correct,
indigestion if
yes.
you took a Tums,
Correct.
If you're not feeling better, you need to come see the emergency department.
Exactly. And then we were talking about, mild symptoms, or, sometimes when diabetic patients present to the ER, with MI, with myocardial infarct, they might not have,
that much chest pain.
right. Mm-hmm.
exactly severe symptoms.
Well, I think there's nothing better, I think, than going to the doctor and thinking that you may be having a heart attack or a heart problem and having a bunch of tests and find out that it's not.
Yes.
I mean, there's a certain amount of relief to that, to know that, okay, I did all these tests and I found out that there's nothing wrong with my heart. My heart is okay.
Right.
That's good news.
Right.
That makes you feel better. Then you're not up at night worrying about having a heart attack or a stroke or anything like that. So there's nothing that relieves people more of their stress and anxiety than knowing that they don't have a problem.
Right.
So knowing that you don't have a problem is almost better than not having the problem.
Correct.
Yes. So make sure that you have the consistent symptoms. Don't ignore it.
Yes,
Either
definitely.
check yourself into the ER or come into the
I have to
your
say-
primary care
Doctor's
doctors
office or-
and do a CAD.
I'm always
that's
shocked
right.
how many people are willing to ignore the fact that a part of their body's not working or they're having chest pain. I'm always shocked to know that someone was willing to wait all day with that.
Yeah, people come in 3 days later and
Your arm wasn't working for 3 days and you're coming now. I would have came in 10 minutes.
If the symptoms are not resolving, like if
Yes.
you had it and the next day you continue to have the symptoms, and the next day you continue to have the
wait,
symptom, and it's
yeah.
not going away.
When is it
It's
gonna?
a sign.
gotta
Exactly, it's
go
a
in.
sign.
Well,
Your heart is telling you,
People are fearful. They're they're
Yes.
afraid
But this-
they're going to find out that something's wrong.
Yes.
Then what they're going to
absolutely.
find out is they're in heart failure because that muscle has died 2 days ago, unfortunately.
Right. Yes. So if you have elevated blood pressure and you have chronic uncontrolled high blood pressures, we have to have it under control. There are many times when we tell patients, you know what, your blood pressure is not controlled. Your blood pressure is not controlled. You need to have it under control because you don't know the long-term,
Repercussions.
of it. Is that you're going to cause your heart muscles
fail.
to work harder it's going to enlarge over time. It's going to get weaker, and you're going to go into heart failure. So over time, you'll see, the side effects or the causations of it. So make sure that you address the problem, right now, and take matters into your hands. Correct? Yes.
Correct.
Yeah.
Yeah.
But oh, go ahead.
You can see that there's multifactorial involved in this. There's your high cholesterol, your hypertension, your diabetes, your lifestyle that as far as smoking and being overweight. So there's a whole bunch of things that may need to be addressed, and ignoring them won't solve the problem. The problem will just get worse as time goes on. If you catch it before it gets worse, then you can make some changes and stop the damage that may be done to your kidneys or your heart or any of your organs. Unfortunately, that people have a tendency to put things off. They say, "Oh well, I don't want to do it now. I don't have the time. I don't have time to go to the doctor. I don't have time to get these tests." But it'll be worse in the long run if they don't.
Yeah, because cardiac infarct, myocardial infarct is non-reversible.
Right.
Once you damage that part, or that muscles of your heart, you can't revive it.
Right. Once
Exactly.
once that scar has formed in your heart where it's been damaged, and actually that piece of your heart is dead, and a scar forms in that lessens the function of the heart, so that the heart cannot function as a pump as well as it did before. So
and a massive heart attack could
then
result in death
you can end
as
up
well.
end up dying.
Right.
And a lot of people have a tendency. You always hear about people who just they just have a heart attack and die. I mean, and successful people, intelligent people, who should know better. So you want to address those problems, especially if you do have a family history of heart disease. Then that's one more reason why you should see the doctor sooner rather than later.
Yes, and we're here for you. So if you have any questions, any concerns, if you if you have the symptoms, make sure that you come in and talk to your primary care providers, or come in to see one of us here. We are more than happy to address any underlying concerns that you have. You're welcome to walk in. Our urgent care is open. And if you have any topics, any questions that you want us to go over at the next get together, leave a comment below in the live chat, and we will address it at the next get together. Yeah, we'd love to hear from you, and any feedbacks, let us know too. Okay. Once again, thank you for.
Thank you guys.
Thank
Thank you,
you,
Dr. Murphy,
everybody.
for talking with us.
And thank you for your attention.
Yes.
All right.
Thank
Thank
you. We'll see
you.
you next time.
Have a good night.
Okay.
Night.
Bye.